What we tried to do is to make sure that before we had the vaccine to give out, that we were preparing our staff and our patients for the knowledge and the questions that they would have. So we created in our first organization with our own staff, because we thought if the staff were convinced that the vaccine made sense, then talking with patients would have that much more power to it. So we convened our own internal workforce, work committee, if you will, on making sure that we talked about the issues that were being to look at the fallacies that were out there for the vaccine. We had a great partnership here in our area in the state, and so we partnered with basically 3 different entities, hospitals and the health department. So again, different health departments depending on where we are in different hospital systems. At the beginning of this, our state went to a model of distributing vaccines entirely to health departments and to our hospitals. And for us to be able to get vaccines to be able to give to our patients, we had to get allocations given to us not by the state but by the either hospitals or health departments, and they were great in making that happen. And then the second thing that really helped jumpstart it for us is at the end of January, we actually had a visit by Governor Roy Cooper of North Carolina and the Secretary of Health and Human Services, Dr. Mandy Cohen, came to see one of our sites where we were vaccinating because they want to understand how we were addressing the equity issue that was not as successful in people, basically historically marginalized populations, getting vaccinated through the hospitals and health departments. But we had made a concerted effort ourselves, and they wanted to see how that happened, and we were able to show them how you could really do that in a grassroots way, as health centers always do. We also wanted to be sensitive to diversity, equity, and inclusion, and so we looked at our own staff demographic makeup, as well as the demographic makeup of our patients and the demographic makeup of our community. And we tracked from the very beginning to make sure that the distribution of vaccines that we were doing was going to match the distribution of our demographics of our patients and our community, so that we were really staying on track with meeting our mission as a health center to take care of the people in our community and our patients that come to us that way. Some of the things that are important for all of us to do is to understand this is a very, very difficult time. And sometimes when you get in the midst of this, you think that it's always going to be difficult. But actually, for the first time, we believe, and I certainly believe, that there is relief in the future, and that comes in the form of this vaccine. So we have really been engaging with that whole process with our staff and our patients and community to that point. And what we started to realize is the milestone that we achieved 2 weeks ago was that for the first time, we actually did more vaccines than tests in a day. That felt great to everybody, because it wasn't just seeing who was sick, it was now we're going to make sure people don't get sick. That's what gives joy. When a woman came in for her 97th birthday with her kids and all of her other relatives, to be able to get a whole dose and make sure that happened with them that way. That was a very, very exciting time. And we took that photo and said a happy birthday in front of her and distributed that to not only our staff, but we also sent it to the governor and to the secretary to make them understand their message was heard loud and clear, and we're making sure people get taken care of. It just brings a bounce to your step when you know you're making a difference in the lives of people.